afternoon. Thank you for joining us for ShotSmart's 2022 Immunization Conference. We've got a great week of presentations, and I'm so excited to get it started. I wanted to thank some of our partners that you see here. Usually you get to see them in person, not this time again, but I hope we get to see all of you in person soon. Next slide, please. So please make sure you're muted unless you're asking a question. I think attendees should be muted upon entry, but it looks like some maybe are coming in. I'm going to go through and just make sure that you're muted. To ask a question, please use the raise hand function, and then Megan will call your name, and you can unmute yourself and ask a question. When your question is complete, please put down your hand. And then you can also submit a question into the chat box, and I will make sure to read those out at the end of the session. I would also ask that unless you are required to have it on, please consider keeping your camera off unless you're speaking, so we can make sure that the bandwidth keeps the presentation and all of our voices nice and clear. And now I would like to introduce our first speaker for the day, Sarah Leeds, our Immunization Program Manager.
Thank you so much, Moran. Can you hear me okay?
Yes, we can.
Thank you. Good afternoon, everyone. Thanks so much for being here. I'm going to just go through some of the changes and updates at the immunization program, both non-COVID and COVID. This organization chart on the screen is our current organization chart for all of our areas of focus. So we have administration, program administration up here at the top. Over here on the left, we have our outreach section, which is education and outreach and webinars and event planning. Here in the middle, we have vaccine operations, supporting providers, purchasing vaccine, helping providers account for inventory, and so much support for quality assurance and support for providers. Over here on the right, we have the IIS, or the Immunization Information System section, and that is basically IRIS, our immunization registry for Idaho. And if you worked with us pre-2019, so the immunization program, if you knew us and worked with us prior to the pandemic beginning, we were less than half of this in terms of the number of positions funded or supported. And this more than doubling of our staff and our team is a result of ramping up for COVID. And so we have data analysts, we have additional support for our IRIS help desk. We have additional staff coming for COVID provider support. We have additional staff coming for COVID outreach and education efforts. And so, as you can imagine, when an organization grows like this or a team grows like this, there are lots of great things. There are some growing pains that we've experienced just to kind of get ourselves and our communications and the new way we all communicate together, both outside of the program and within our teams, is a challenge, and we continue to work on improving. We've got a fantastic team here, a really solid foundation of staff who were here prior to the pandemic, and a lot of great people who have joined the team and are supporting all of our efforts to provide services and support to all of our pediatric and non-COVID vaccine providers, and also all of our COVID providers. Sorry, there we go. So here's a close-up, because that slide was so hard to read and keep on one slide. I've also broken it down into the various sections so you can kind of get a sense of how we operate. So this is sort of management and administration. And we have some permanent positions here, and we have two folks from CDC, Jeff Kingsbury and Sarah Bond, who are public health associates, and help support our everything we do in terms of long-term care, COVID vaccine work, reporting, and ensuring that we have a good, solid communication line to CDC. And then here's our various section managers: Gwen Baker for the IIS, Tamara Olson for vaccine operations, and Marin Axtell for outreach. And then we've got Megan, who is our administrative assistant, who is incredibly supportive of all of our, sort of that foundation of everything that an administrative assistant does. They are, really the glue that holds us all together, and Megan is that for us.
That's what I found.
And Sarah Garrett is our COVID-19 project manager and has been with us over a year and helps support the work that we're doing with providers and contract management, and just kind of a jack of all COVID-19 vaccine support for us. And this is the outreach section. Again, Marin leads that effort. We are in the process of moving Emily Doris, who's our COVID, she's our school and child care coordinator, and currently works in the IIS section, but we're in the process of moving her into the outreach section so that there's a lot more education and outreach for our school and child care coordinators across the state. And then these two positions are funded by COVID-19 supplemental vaccine funds, and they will, they're in the process of being advertised in the next couple of weeks. And this is the vaccine section. They've grown quite a bit over the past 2 years, and these positions, a lot of them are vacant, these COVID-19 vaccine support staff. It's taken us a little bit of time to get the approval and get them posted and getting interviews scheduled. And in the meantime, our core staff have been incredibly busy juggling both routine vaccine work and also COVID work. And they've done an incredible job, and we're all excited to get these new positions going so that everyone can go back to normal, and whatever normal means. I'm putting air quotes around normal, normal workload. But they've spent the past year and a half incredibly busy and doing a lot of supporting providers for ordering, administration, inventory management, storage and handling, and so much more vaccine purchasing. And Tamara on Friday is going to be presenting and giving you a lot of detail about everything that these folks do in much more detail. And the IIS section, our Immunization Information System section. Gwen Baker joined our team in August. She's our IIS manager, and we now have a staff of data support, of data analysts, and a lot of help desk staff. We have some support from the CDC Foundation through some team members, and that's been provided funding through CDC to the CDC Foundation, and this was a great help. We were asked, what do we need and what positions do we need, and we were able to work with the CDC to recruit and interview these folks, and they will be with us for a little while longer, and they're providing some great data support for us. And Gwen on Friday is going to be presenting as well about the IIS section and the data exchange through IRIS and all the data that we're getting. And as you can imagine, because I know you all are doing so much COVID vaccine immunization work on top of the regular immunization work that you do, and the data that is now coming into IRIS has been an exponential growth, and the number of records that we have in IRIS has experienced exponential growth. And so this team is really helping us improve the data quality, to work with providers on the data quality, and then provide analysis of that data to support improvement efforts. So I wanted to go over a little bit of our funding. This is our core funding. So this is all non-COVID funding. And we have, our budget includes this year a CDC, what we call our basic grant, and that supports all of our program operations that are not related to COVID. So lots of focus on, this supports our core personnel, support for the subgrants that we have with our public health districts. It supports some of the expenses that we have around our IIS vendor, marketing and education campaigns, some vaccine purchase. There's a lot that goes into that $3.2 billion, and a lot of work that we do throughout that. We do have some state general funds that support about half of that goes to some subgrants to the our local public health districts to support the vaccine work that they do and help kind of give us an extra hand in some of our obligations for provider education and provider compliance visits. And then the remaining source of those general funds also cover anything that the federal funding does not allow for, as you know, a lot of requirements around the use of federal dollars and regulations. And so there are some things that we need to purchase that maybe aren't allowed or just help to supplement those funds. The Vaccine Assessment Fund, that is $18,700,000 this year, and it is supporting the purchase of vaccine so that providers don't have to have multiple inventory to support VFC vaccination and also non-VFC vaccination. So that is a collaboration that we have with the Department of Insurance, where we purchase the vaccine with these funds and for children 18 and under, and then the Department of Insurance will reimburse for kids who are covered not by that, but by the VFC, the Vaccines for Children's program. And then high-tech funds, we had that for several years. It was money from the Centers for Medicare and Medicaid, and it supported infrastructure development and data exchange for providers. And that funding expired. It was federal; those were federal dollars that supported our IIS work and enhancements to IRIS, and that expired in September. But we were lucky enough to have that for several years. And for that quarter, we had about $163,000 to support that. So that's our core funding rate right now for this fiscal year. We will not have those high-tech funds next year, but we will have approximately the same amount of funding for each of the other categories. So the one thing I wanted to talk about before I moved into COVID is there were a lot of bills proposed and some rules this legislative session, some of them being regulations on what schools could require around infectious disease transmission. None of them made it out of the, they either didn't make it out of the committee or they passed one chamber of the legislature but not the other. But there were many proposed public health bills and specifically immunization bills. Another example of one would be there was a proposal to make our immunization registry opt-in And currently, for those of you who don't know, our immunization registry is an opt-out. So all providers, when they administer vaccines, should be talking to the patient that our registry is, the patient will be, when an immunization is administered, the patient will automatically go into IRIS unless they opt out, intentionally opt out. And so one proposed bill in a committee was to change that back to an opt-in, and that did not go forward. We expect some of these bills and rule changes to be back again next year. Our role in the immunization program and the Department of Health and Welfare is to implement and administer and make sure we are adhering to the rules that the legislature passes. So we don't really have a role in changing those. Our role is to make sure that those are carried out to the legislature's wishes. So we expect continued efforts like what happened last year, or I should say this year, next year. And so we are lucky in the Division of Public Health that we have someone who tracks that, and folks in the Division of Public Health are usually asked to provide an assessment of the impact on those. And so we have Dr. Turner, who's our Bureau Chief of Communicable Disease Prevention, and Dr. Hahn, who's our Division of Public Health Medical Director. They are the ones who usually provide that input and what the impact will be on public health and when those rules come up. So, we'll continue to work and try to stay aware of all of those and provide the assessment of the impact of those as we learn about them. So COVID-19 updates. I'm going to tell you a lot about some about our funding. So we, over the past 2 years, have had some money that was from CARES Act, ARPA, and what we call CRISA. And I've got a few slides that show you explain those acronyms. So the CARES Act was one of the first funding from the federal government that was for pandemic response, and its Coronavirus Aid, Relief, and Economic Security Act. So the immunization program was awarded $608,810 for supplemental influenza, and that was in June of 2020, and that supported adult influenza vaccine efforts because back in that time, if you remember, we did not have a COVID vaccine, and we were very worried about what influenza season might look like, and we wanted to get folks vaccinated against influenza, so the CDC provided funding to support that. Then in December the Supplement 1 came in September of 2020, and we were awarded $869,836 that helped support a couple of staff members for us. I think it was 2, and then to gear up for really the vaccine planning that we were doing and anticipating. Then in December of 2020, we were awarded a second supplement from the CARES Act, and it was, again, a $608,811 award, and that the immunization program chose to allocate all of that to our local public health departments, some of our tribal partners, and our federally qualified health centers to help them get ready for administering COVID vaccine. Then in January of 2021, we were awarded a little over $16 million within a third supplement of money, and that came from the Coronavirus Response and Relief Supplemental Appropriations Act. We also got a fourth supplement in the spring of 2021. And if you look at both of these bullet points, I'll show you here. So we have supplement for just under 7 million. And then down here under ARPA funding, we have $13,748,993. So our fourth supplement that we were awarded by CDC was over $20 million, but it was from different funding sources. That has presented us with some challenges in that any funding from the American Rescue Plan Act or ARPA funds our state legislature has required that we get annually specific approval, not just budget authority to spend those dollars, but also they want to approve the specific expenditures within those awards. So from the coronavirus, what we call CRISA funds, we had a little over 16 million. Then we had just under 7 million. So from ARPA, like within a couple, I think in the spring of 2021, maybe a month after we got the 16 million from Supplement 3, we got a Supplement 3A, we call it, and that was from ARPA funds, and it was just over $10 million. And then I have a slide coming up where I'm going to tell you the details about that. But we had to get, by the time we got this last year in 2021, the budget had already been approved by the legislature. And so our leadership went back to the legislature, to JFAC, the Joint Finance Approval Committee, to get permission to spend this $10 million this fiscal year. And it was decided, the Division of Public Health and the Immunization Program wanted to make funding available to all COVID vaccine providers. So 9 million of that funding currently is allocated for some mobile grant money, and I'll talk a little bit about that in a moment. The focus of Supplement 3 was to really administer vaccine. And when we got Supplement 4, the focus is still to administer vaccine, but there is a very significant emphasis on ensuring access, ensuring equity, and really working at the local level to do those things. Late in the spring, we got another supplement, which we call 4A, in the amount of $1.3 million and that is from CDC, and it is dedicated to COVID-19 communications. So there's, as you can see, almost a bit of a mind-boggling amount of money when you look at these dollars, when you compare them to what our regular core funding looks like. There's just so much more funding here. And so we're working to distribute that throughout the state, support our staff and efforts, and also, just increase equity. So that $10 million from Supplement 3A that was on the other slide, then the application, if there's funding that you need that could help increase your vaccination efforts for COVID-19, and you just don't have the infrastructure in your staff, in your clinic to do what you'd like to do, I encourage you to take a look at this COVID-19 vaccine clinic funding. So you can click on that box that's on the coronavirus.idaho.gov page when you go into the vaccine tab here. You just click on that box and you get right to the funding guidelines. And Sarah Garrett, who's our COVID-19 vaccine project manager, is leading the efforts to support our providers who are sub-grantees, And we currently still have over $3 million available in that's unobligated. So if there are some ideas you have that you need funding to increase your vaccination efforts across any of the populations or all of the populations that you work with to increase COVID vaccine coverage, we encourage you to take a look at that application. And if you have questions about it, if you want to apply for those funds, we'd love to work with you. And Sarah can help you with that. And it is a first come, first serve type of application process. So we've had some providers who have, they submitted an application and we had some questions. So it isn't a, kind of you either get it or you don't. If you apply and you have a good solid plan, but there's something that we need more detail on, we contact you back and just say, hey, we need a little more information about this, or, this piece of your budget is not allowable, but how about, we really will work with you to make your application successful and fundable. So I encourage you to reach out if you're interested. So again, this is the $9 million that's available. So we have $3.4 million left, a little more than that. So just as I wrap up my section, our continued focus, particularly with COVID, but in general, we are really focused on equity, access to vaccine, support for local efforts. We really are working to identify trusted messengers within the community. So we want to listen to those community members and empower them to be the voice of instilling confidence, not only for COVID vaccine, but for all vaccines. And so we're really excited. All of this COVID funding expires in 2 years, June 30th of 2024. And so there's a lot more work to be done. As we all know, COVID vaccine demand has been waning, but we hope that these funds will help us really build infrastructure that not only supports COVID vaccine administration, but really confidence in vaccines, as we've seen, confidence eroding over not just the past couple of years, but really, it's grown a lot over the past couple of years, the efforts to erode public confidence in vaccines. But we're hoping that this funding will really provide us some ability to have a strong infrastructure when COVID-19 funds go away. And so now, turn it over to Marin.
All right, thank you, Sarah. Next slide, please. The first thing that I want to share with you that I'm super excited about is having new positions in the outreach section. As Sarah mentioned, our school and child care coordinator, Emily Doris, is moving into the outreach section, and we're going to focus a little bit more on education and outreach to our schools and child care in the area, and definitely very excited about that. The new positions we have are the outreach and education coordinator. And this position will really focus on community assessments and listening sessions. We're hoping roughly quarterly with a lot of different groups to kind of keep an ear on the ground about what people are thinking in the community and how things are shifting as the pandemic also shifts in a lot of different ways. They'll also be doing some education for you all as vaccine providers, schools, and childcare. And then the outreach and education specialist will be reviving our webinar series called IPI. I think some of you may remember the Idaho Provider Immunization Education Series, and then also super excitingly managing our process for awarding CECs. I know it's been a huge bummer that we haven't been able to offer those over our past few events, so I'm really excited. We're going to have someone on board who can manage all that paperwork, and we'll be able to start to provide those credits for you all who need them. So really just excited to get these guys on board, grow the outreach section, and I'll be really excited to also share some of our accomplishments the next time we get together. So moving into some school and childcare news. Next slide, please. So this is a huge chart with a lot of numbers that I do recommend, if you're interested, you take a look at when the slides are posted later. However, I do have some takeaways on the next slide. So what we have here is a little bit complicated, so I just want to break it down for you a little bit. In that first column, the data we have there is from the 2019-2020 school year, which we kind of consider to be the last, quote, normal year of reporting before the pandemic. And then I have two more sections of columns that are broken down into 2020 and 2021 school year, and then the 2021-2022 school year, but separated by K through 7 and K through 12. We have them separated out like this because we just started requiring 12th grade reporting during the 2020-2021 school year. So just kind of looking at them a little bit separately over the next few years, and then we'll probably look at them together. But as you can see, across both of these groups, we've seen a pretty significant decrease in the adequately immunized school children in Idaho. You can see from the 1920 to the 21-22 for K through 7, we've had about a 6% drop in adequately immunized. So obviously this is something we're really concerned about. We're taking a much closer look at as we start to be able to kind of turn back towards being able to do our more routine work, and kids are more routinely back in school. We can definitely tell that the pandemic had a really large impact, and that's something that schools were telling us as well. So next slide, please. So to help kind of think about mitigating the decreases in these immunization rates, I wanted to just identify a couple of best practices, probably things you've heard before, but always good to hear again. So I think one of the big ones is to identify an immunization champion in your clinic, someone who can really focus on process and improvement in the clinic for immunization specifically. I would also recommend working with the immunization program during an IQIP visit to set goals, get some recommendations about things that maybe work in other areas or in other clinics that are close to you, and really be able to measure impact through those visits. So really great resource there. Think about checking immunization records at every visit. If someone comes in and my toe hurts or I fell off my bike or whatever it is, you can also check and say, hey, you're also due for these vaccines at this time, so why don't we just get that done while you're here? Similarly, presumptive recommendations have been shown to increase acceptance of vaccination. So if you haven't already implemented presumptive recommendations, I recommend testing it out and seeing how it works with your patients. And then obviously there are some patients who will have questions, concerns, and we would definitely recommend motivational interviewing to get to the heart of a patient or parent's concerns. And we actually, this Thursday, our ShotSmart session with Trevor Manthe is on motivational interviewing and specifically in immunizations. And then I would also ask if you have any other tips or tricks that you've found that have worked well in your clinic, please drop that in the chat. It's a super crazy time for vaccination, and I'm sure everyone would love to hear, success stories and maybe something that they can implement in their clinic. So those are general best practices. And then we also have some requests that we've heard pretty often in our communication with schools. So definitely education and resources about vaccine preventable diseases and about immunizations. But specifically, they're looking for non-government resources, which is a little hard for me to stomach because I make a lot of those, but I can definitely understand, especially in this supercharged politicization of immunizations, that maybe a non-government resource would make people feel more comfortable. So if you have those, if you need help finding them, please share them or let me know, and we can definitely get you a bunch of different resources. They are also asking for really strong healthcare provider recommendations, so that kind of goes back to presumptive recommendations, motivational interviewing. They would like better access for their students, so if you have a school in your area that you can partner with to offer clinics on site at the school, free clinics at certain hours or even extended hours clinics, especially for some of the high SVI, high social vulnerability index areas of the state, they think that those would be really helpful. And I don't think a lot of schools are aware that they can partner with you, so maybe reach out and just offer it, because it's just something that I think a lot of them really aren't aware of. So again, if you have a partnership with a school or have done on-site clinics or anything like that, if you have any tips or tricks for how you've made that successful or things that you've learned that maybe you would do differently in the future, then please drop those in the chat as well. So one exciting thing that we're doing in the school and childcare world is getting the school immunization report into IRIS. So the school immunization report is required annually for kindergarten, first grade, seventh grade, and 12th grade to report on all the different antigens that are required for school entry. So we have had that in kind of a separate system, but we are now putting a new module for schools in IRIS. We're really excited to help streamline the connection and collection of data and reporting and improve our data storage and quality and analysis. This actually shouldn't affect most of you, but I did just want to give you a heads up because schools and healthcare providers have different views in IRIS, and some of the schools may have some questions. So just wanted you to be aware and kind of cognizant of those differences and that this new thing is happening. So now moving more into media and outreach, the COVID and flu campaign finished at the end of March. We've got some really great initial data. There's a little clip right there of it, and some really good uptake with this particular outreach campaign, especially with our Spanish radio and Spanish radio streaming services. So that's been really exciting finding. The final campaign analysis will be shared actually this afternoon, so I'm a little sad about that timing. But if there are any other really big takeaways, I will be happy to share with you all. And then we're kind of shifting the way that we're talking about vaccines and placing them as kind of part of a healthy lifestyle. And that seems to be showing promise, and we're working that into our newer campaign, the ones that are coming up. The COVID Priority Populations campaign is a campaign that we are working on right now. It is a testimonial campaign targeting all of these different groups that you can see here. And filming has begun. They started filming last week. They'll do some this week and then a couple more times over the next couple of weeks. The project will be fully complete by June 2022, but we do hope to release it in phases. So as we get some of this filming done, we can start pushing it out. I also want to say thank you so much to our partners at the Idaho State Independent Living Council, or SILC, and the Division of Public Health Equity team for their partnership and funding opportunities. This is a really, really large campaign, and I think it's going to be really wide-reaching and kind of targeting some of these especially higher risk communities that we really want to reach. This is just a couple photos, a couple stills that were sent to us from Restart, our marketing partners. And these are some of the people that were talking about why they chose to get vaccinated and why they think COVID-19 vaccine is important. So we're really excited, really grateful to all of our volunteers, and we think this is going to be a really excellent campaign. Next slide, please. And then upcoming events and partnerships. We're doing a lot of stuff. We're getting back out there. It's super exciting. We are partnering with Boise State University, Idaho State University, and the University of Idaho. I did hear from them. We've been having a baby crawl at Boise State University for the past couple of years, and it's incredibly popular, very adorable. If you haven't gone, I highly recommend it. And Idaho State and U of I were a little jealous, and they wanted one too. So we're expanding that to all locations. The immunization program will also be tabling at a couple of those events, and we'll have lots of social media. They're always great about that. Another event coming up is the Western Idaho Fair this summer. Last summer, we actually partnered with Preventative Health, who administered around 11 COVID-19 vaccines at the fair, which doesn't sound like a lot, but I think, especially in these times, every vaccine that we can get into someone's arm is a huge win. So it was very exciting for us. And we're thinking about how we can maybe expand that this year and be able to provide COVID and VFC vaccines. And just have them available if people are interested, because some people are. We will also be attending the health fair at the Hispanic Cultural Center, and this is sponsored by the Idaho Immunization Coalition. This is the first year that they'll be doing it, so we're interested to see how that goes and how it turns out, and hopefully it'll be something that keeps going for many years. We also will be at the School Nurses of Idaho annual meeting. That has been virtual for a little while, so we think that'll be good to kind of get back into it, kind of reconnect with the school nurses in Idaho. Family Palooza is a super fun event for families and children. It happens every summer in Boise. and a whole lot more. We're going to be out and about talking about vaccines, and not just COVID now. We'll be able to talk about VSC vaccines as well. And we are hoping, cross all of your fingers, all your toes, please knock on wood, we are hoping to have booster shots in person this fall, and I cannot wait. We've really missed being able to talk to you in person, seeing you, and having those kind of smaller conversations, especially at booster shots. So keep an eye out for it. I'm planning it in person and hoping it all works out. So I believe that is my last slide. If anyone has questions, please feel free to put them in the chat right now, or feel free to raise your hand and ask it out loud. I'll give you a couple minutes for that. Oh, let's see. We do have a question in the chat. What kind of non-government resources do you suggest? Hospitals? Yeah, so hospitals are a great one. There are a lot of universities, especially, that do research, like Children's Hospital of Philadelphia also has some research that they do. That is a great resource. Immunize.org is also a great resource. And I will talk to our QA staff, our quality assurance staff, who you all know, and they have a lot more resources than I can just think of right off the top of my head, and we'll make sure to get that sent out. And if there are no more questions, please feel free to hop off, get a few extra minutes in your day. I know that's so precious these days, but I'll hang out for just a few more minutes, just in case anybody else has a question that they think of. And we'll see you later this week. Thanks, guys.